Thank you. Senator Kaine.
Thank you, Chair Sanders, and congratulations, Dr. Bertagnolli. I'm happy to support your nomination. Every time a representative of the NIH comes before us, I ask for an update on the Recover initiative. Congress provided NIH with $1.15 billion in funding to advance understanding, prevention, and treatment of the long-term effects of COVID, including long COVID. And this is a topic very important to me because I live with a mild form of long COVID. Because I've been public about that, I hear from people every day. In this body, I have colleagues, former Senator, former colleague Senator Inhofe, Senator Young, have talked about long COVID experiences. My wife went to a lawyer last week with a friend of ours to help her file for bankruptcy because her treatments for long COVID that knocked out her balance now leave her in a situation where if she doesn't file for bankruptcy, she could lose her home. I was at an event Monday and a technology CEO came up and talked to me about his wife's experience with acceleration and deceleration of her heart rate, which is a fairly common long COVID symptom. About 5.3% of Americans now have long COVID, and of those, that group, 80% suggest that their long COVID significantly limits life activities. Americans depend on research coming out of NIH to help understand how to treat, cure, prevent symptoms that are often debilitating. And it frustrates and saddens me to hear how many long COVID folks who are dealing with it have both had a negative impact on their life, but often face skepticism and disbelief as they describe their symptoms to employers and others. And I'm also frustrated when I hear long COVID sufferers indicate that NIH isn't doing enough on the issue and that their voices aren't being heard. Let me tell you what patient advocates tell me. That NIH isn't considering the input of those living with long COVID in the design and enrollment of long COVID clinical trials. That NIH is not as responsive as it should be to advocate outreach. That with Recover being spread across multiple institutes, there's lack of clear leadership and the initiative lacks kind of a point person that's held responsible for decision making. There's a lack of transparency in the budget and future plans for the initiative. Dr. Bertagnolli, I know your work in the Cancer Institutes has not put you directly into this space, and so your knowledge of the inner workings of the Recover initiative are limited at this time. But should you be confirmed as director, I ask that you continue to work with me to address the concerns of those living with long COVID, including that you commit to meeting with patient advocates to discuss these issues.
So, Senator Kaine, thank you very much for that question, and I can absolutely confirm that I will work with you on this issue. I think this is one of the greatest tragedies we have recently seen. And I'll tell you one thing that is something I live by in my research. I love the expression, nothing about us without us. This comes from the people with lived experience community. Maybe we call them the patient advocates. And I love that expression because it really is the way we need to do our science. It not only are we then serving them because we're listening to them, but all the other issues of trust and accountability and respect for the people we serve happen when you do that. So you've hit something that it goes to my core, and I'd be delighted to work with you.
Thank you very much. Next topic I want to ask you about is pediatric cancer research. Along with Senator Moran and 13 other bipartisan members of this body, of this committee and the full body, we introduced a bill called the Gabriella Miller Kids First Research Act 2.0 to reauthorize a program that is aimed at combating childhood cancers. The legislation is the result of continuing efforts by the Miller family to fight childhood cancer, and their revelation to me 10 years ago that of the NIH research budget, only a very, very tiny percent, less than 1%, was devoted to pediatric research in the cancer space. I'm pleased to say that the bill was voted out of the committee last month with a very strong bipartisan support. I know you're familiar with the challenges in combating childhood cancer in particular. As Congress looks to reauthorize the critical program, can you tell me how NIH will continue to expand its efforts using data sharing to speed up research, for example, particularly for childhood diseases such as pediatric cancers?
Yes, thank you. And this has been a major focus of my work since coming to NCI and would absolutely be carried over at NIH. And since time is brief, the beautiful, beautiful Gabriella Miller, when she looked into that camera, I'm sure you've seen it, looked into that camera, and I'm paraphrasing, I don't remember exactly, but she looked in that camera and she says, "Quit talking, get working," or something like that. It just gets to your heart, and we take that very seriously, and that's what inspires us to go forward.
Thank you very much. I yield back.